Okay, let's move on. And Doc, let's talk about shoulders. I had a shoulder surgery done by Dr. Cole back in February, and rehab. I had actually my second rehab now, and it's going very, very well. This one a little better than the first one. Got into some dry needle therapy, which is really great. But boy, it is such a complex joint, isn't it? Different than knees and elbows and different things like that.
You know, Steve, in my 30 years of orthopedic surgery, it's without a doubt the most difficult joint to rehabilitate. And you know me, I've been a baseball doc for 18 years now, dealing with, professional athletes and major leaguers. We always cringe when one of our players goes down, a pitcher goes down, whether they have surgery or non-surgery. Rehabbing a shoulder is so much different and so much more complex than a knee or an ankle or certainly even a hip. So, I think that's what we're always looking for, new techniques and new innovations. It's a joint that really is a combination of both dynamic stability from the muscles as well as the intrinsic stability of the capsule and the joint itself.
Well, let's bring on an expert. He is a doctor of physical therapy for IV Rehab Physical Therapy based out of Lake Zurich, Dr. Rich Colossi. Hello, Doc. How are you?
Hello.
I'm
doing well.
Good. Thanks for joining us this morning here on Sports Medicine. We're going to talk about shoulder injury chain reaction rehab. And before we get into that, I know Dr. Chuck had an interesting question for you that we were talking about off the air.
I got to be honest with you. We talk to a lot of therapists on this show, and a lot of them have innovative theories. But really, I think I just want you to explain to our audience, what does it mean to be a doctor of physical therapy? What was the additional training and research that you did to get to that level?
Well, to become a doctor of physical therapy it's a postgraduate terminal degree in which we're, I don't want to say required, but that's one of the requirements for the doctorate is to be very adept at research, at evidence-based practice. We receive specialized training in differential diagnosis, as well as a pretty versed understanding of pharmacological intervention, as well as a little bit more of an enhanced ability to screen over and cover medical imaging with clients and be able to speak to physicians with a little bit more of a medical specialization and background.
Well, why don't you go ahead and take us through the theory on chain reaction? I mean, we always, as physicians, have always used the term kinetic chain.
Right.
The same thing, that everything that goes up and goes down and everything's connected. Why don't you explain to our listeners what your thought process on this, and how do you explain it to your patients?
That's a fantastic question, and I think that Dr. Bush Joseph hit the nail on the head. The shoulder is a complex joint, and oftentimes, it takes a hit for other regions of the body that don't necessarily do the work. Dr. Bush Joseph mentioned pitchers, for example. So if somebody comes in with anterior posterior shoulder pain, well, as a therapist, we have to uncover basically what else or what other regions of the body are not supporting that posterior labrum, that anterior labrum. And oftentimes we look at the whole body as interconnected, summation of parts rather than it's a shoulder problem, let's just rehab the shoulder, and hope we've attempted to stabilize it enough with the muscular structures. I think as doctors of physical therapy, we have to look a little bit beyond the joint that a patient is coming with dysfunction or for surgical. We have to look at things like the opposite side hip and how it contributes to the ability for the posterior cuff to decelerate that throw, or how the same side hip needs to be able to go through adequate extension when a person reaches overhead and performs repetitive overhead activity. Do they have the mobility and the capability to utilize other joints to support the smaller kind of picked-on joints like the shoulder, for example? So chain reaction biomechanics is looking at the body as a summation of parts and how all the joints are interconnected and must play a role in sequencing, and how they drive motion through the hips into the thoracic spine, and certainly how they drive the scapula and the glenohumeral joint.
Well, let me ask you this, Rich, in a sense, when you're seeing a patient coming in, say a mid-30s or early 40s patient with symptoms primarily of cuff impingement, we'll say, nothing serious, traumatic. We don't think there's serious structural tissue damage. How do you work from the shoulder out or from the hip up, or what's your thought process on that initial patient evaluation?
No, the biggest question is it depends, and it depends on the individual. So there isn't a one-size-fits-all philosophy or evaluation technique, so to speak, for any one individual. So when human movement's executed, basically the first movement is in the opposite direction. It's the load. For example, is to stretch a rubber band. You have to pull it back to let it fly and get that powerful explode. Very often when you talk about shoulder impingement in particular, the symptoms are during the explode, but their cause is it could be a poor ability to load somewhere else along the kinetic chain. For example, what we talked about with the pitcher and the opposite side hip and the inability to decelerate motion or to accelerate motion to be able to create the power that one needs. So in order for the impingement to clear, so to speak, with overhead movements, the thoracic spine has to be able to go through extension to allow the scapula to clear the spine. The hip has to be capable of telling the thoracic spine to go through that extension, and certainly that goes all the way down to the ankle because the old song was the hip bone's connected to the knee bone, and it's true in this case of impingement as well.
Visiting with Dr. Rich B. Colossi. He is a doctor of physical therapy for IV Rehab Physical Therapy based in Lake Zurich, Illinois. I'm Steve Kashul with Dr. Charles Bush-Joseph, substituting this week for Dr. Brian Cole at Sports Medicine Weekly. Our website is sportsmedicineweekly.com. Our topic, shoulder injury chain reaction rehabilitation. I've got one for you, Doc. Does this chain reaction approach apply to any other injury besides the shoulder?
Oh, for sure. The chain reaction principles apply to any joint structural issue or biomechanical disadvantaged joint that's taken a hit. For example, if we have a patient who comes in with knee pain, it's very seldomly the knee that is actually the source of the pain. It's coming from either the bottom up, which is oftentimes comes through the ankle, or an inability for the hip to go through its proper load to help turn on the muscles that control us under gravity and ground reaction force.
Rich, I guess the last thing that some of our listeners love to know is how quickly can you turn these things around? If you identify a patient clearly who presents with shoulder pain or shoulder impingement, and you really identify specific hip weakness or a low back issue, how quickly can you turn that battleship around for a patient?
The answer, again, is it depends. It depends on what comorbidities they come in and present with, what their past medical history is, and we really rely on doctors like Dr. Chuck Bush-Joseph to give us that script or give us that comprehensive care of what's occurring with that patient. That being said, if it's a shoulder impingement, it's turnaround time for resolution of the impingement is anywhere between 2 to 4 weeks, depending on how compliant the patient is with their home program and how we can achieve the most amount of motion in a short period of time.
Terrific stuff. Appreciate it. Dr. Rich Colossi, Doctor of Physical Therapy, IV Rehab. Let's take a break, and when we return, we're coming back with our Ask the Doctor segment. I'm Steve Kashul with Dr. Chuck Bush-Joseph. It's Sports Medicine Weekly. Stay with us, only on 670 The Score.